everyone. Thank you for joining us for another session in our brown bag series in professionalism in healthcare. Today, we're going to talk about adverse childhood experiences, part 1 today, and then Wednesday will be a continuation of it. For those of you who don't know us, well, I'll try to advance the slides. So my name is Nyaboni. I'm with the South Central Area Health Education Center, and what we do is workforce development in healthcare, and we're hosted by the Alaska Primary Care Association, and a lot of what we do is, well, I guess we work with like youth and adults to provide like a pathway into healthcare careers. So we do that through our camps and our career trainings. And then of course we provide professional development too. So for today, if you're not already familiar with how to use GoToTraining, you have the ability to mute and unmute. I would like to make this session as interactive as possible, so if you have a comment or a question throughout the presentation, feel free to unmute yourself or to use the chat box, which my colleague Kayla will be monitoring, and we'll try to answer to whatever questions come up in that. And of course, if you would like to get my attention, you can raise your hand and utilize that function. So I'm actually going to turn off my video because the presentation has quite a lot of graphs, and of course I don't want my to be in the way of that. So let's do that. So today we're going to talk about ACEs, or adverse childhood experiences. On Wednesday, we'll kind of dive into trauma-sensitive practices and kind of what we can do to prevent or address ACEs. I will say that this presentation might bring up or trigger emotions from past experiences, so feel free to step away or kind of take a moment if you need it. And I think many of you might have already heard of ACEs or are familiar with some of the content. And so I hope, you know, whether you have no ACE knowledge or a lot of ACE knowledge, that you're still able to take away something. So there's going to be lots of information. I'm going to try to cover as much as possible. And there's going to be a lot of data, and kind of you might reflect a lot on some of what we talk about. So again, if you need a moment, or if you need additional support even after this presentation, feel free to reach out. We are here. So although, you know, we can recall and describe with words much of what happened in our lives, the memory of our human experiences is stored inside of our bodies and not just our minds. And so I invite you to take a moment to go down memory lane and kind of think about, you know, do you have a childhood smell that brings you back to those moments? So this might be fresh mown grass, having you feel maybe the warmth of sunshine, and that reminds you of spring, or the smell of cinnamon, you know, causing you to kind of remember those moments of maybe cooking cinnamon rolls with your grandmother. Things like that. Those are examples of your body remembering before your brain tells you what it is. And sometimes those memories can be negative, such as fireworks or a car backfiring or causing a war veteran to race back and have flashbacks of a war zone. Okay, keep those in mind. So adverse childhood experiences, or ACEs, is a term coined by two researchers, Dr. Vleddy and Anda, while they were researching the effects of adversities in childhood and adult health. And it's important to note here that these experiences happened prior to the age of 18 and had the potential to harm brain development and adult health. It was a risk that they were trying to assess, and it wasn't a definite cause. And the ACE study was, conducted over 20 years ago in Kaiser Permanente, which is in San Diego, and it's a managed healthcare agency, which is, you're probably all familiar because you work in some healthcare capacity, but basically a place where someone can go and get all of their medical needs. And what Dr. Vleddy and Anda did was ask patients to fill out an anonymous survey about what happened in their life as they were growing up to the age of 18, along with some medical questions that they also asked about regarding well-being. And of the survey that they distributed, about 17,000 participants filled out the survey, and the ages ranged from 19 to 92, with the average age of being 57. And the demographics of the survey respondents were 70% who answered were Caucasian, 60% were college educated, and all had medical coverage or insurance. So there were 10 questions related to ACEs that asked about things like various forms of abuse. So loss of a parent, maybe domestic violence, and other situations. And the way people answered it was based on recalling their experience of any events that happened before their 18th birthday. And if you can see on the screen there, like those are the 10 questions that the ACE questionnaire asks. And of course, there are some limitations to this study. It only measures 10 types of trauma, while we know that other negative experiences might affect health as well, especially those outside of the home environment. So recognizing that trauma is not limited to those in the ACE study, and can include things like community violence, war, or maybe even historical trauma. But it did provide a snapshot of what can be experienced in childhood and the health outcomes as a result of these events. So the results of Anda and Vleddy's questions about ACEs are shown here on this slide, and it has 10 categories of adverse childhood experiences that were studied and the percentages of the participants that experienced that ACE. There were 3 forms of childhood abuse that were studied, so emotional, physical, and sexual abuse, and 2 forms of neglect, being emotional and physical, and then household dysfunction, which included, maybe growing up with a substance abusing household member, alcohol or drugs, parental separation, divorce, maybe growing up with a mentally ill household member or caregiver, maybe witnessing partner violence, and things like that. So as you can see from the percentages that are on the slide within each of those categories, ACEs are pretty common in this middle class, well-educated population. And that's an important point to make as far as what came about out of the study. So because adverse childhood experiences are so highly interconnected, it didn't make sense for the researchers to look at a single category of ACEs that influence health and social problems, but instead they developed an ACE score between a score of 0 to a score of 10. And each of the categories that you saw in the previous slide counted just as 1 point in the ACE score. So if a person experienced physical abuse, no matter how many times or what the severity of that abuse was, the ACE score is 1. If the person experienced physical abuse and had substance abusing parent, the ACE score would be 2 because it's 2 separate categories. So you can think of the ACE score as a measure of the childhood biological stress dose. The higher the ACE score leads to an increased risk of developmental effects of toxic stress. And we'll talk later on about what toxic stress is. So in the illustration, you can see that about 1/3 of the people in the study had an ACE score of 0, and about 16% of those participants had an ACE score of 4 or more. Again, it just shows that adverse childhood experiences are common and they tend to cluster. And often when one person has an ACE, such as substance abuse growing up, there might be another adversity in the household too. In the survey, of course, they also asked about a person's health history and well-being. And from the results, they found a dose-response relationship, meaning as the ACE score went up, the percentage of people with a health and social problem also went up, as you can see in the slide indicated by the arrow. So people who reported a higher ACE score are more likely to have social and health problems. And that still holds true today, as this study has been replicated through the BRFIS survey. And, according to the CDC, about 5 out of 10 of the leading causes of death in the US are associated with ACEs, which is very interesting. And, and as we have this conversation, I go through this presentation, you have to remember that this is a higher risk. It doesn't mean if someone has ACEs that they'll automatically have those problems. And in fact, people with many ACEs may not have any adult health problems because of resiliency, which we'll talk about later on. So the results of this study were so significant 20 years ago that states across the nation have duplicated it to see if the data is still true for today. And this is through what's called the Behavioral Risk Factor Survey, or BRFIS, which is given every couple of years, usually by the Department of Health and Human Services. This slide are just a few statistics that came from the CDC website. About 61% of adults in the United States experience at least one ACE. About 1 in 6 adults experience an ACE score of 4 or more. And about 44% of children in Alaska had an ACE score of 1 or more. So the survey is usually administered through phone, and this graph here is from 2013 to 2015, and it shows it by the percentage of Alaskan adults compared to 10 other states, and might be slightly higher in some of the ACE categories, but there wasn't any statistical significance. This slide is also from that same BRFIS study done more than a couple years ago. It's quite a long time. but the results are similar to the original study. It shows that the number of ACEs and how it increases the risk of smoking. It could be, the current smokers currently also follow the dose response pattern that we saw earlier. For COPD, that might be a little different, but it does increase with the number of ACEs as well. Here's another one with ACEs compared to suicide attempts. And according to the CDC, there can be a 44% reduction rate in adults experiencing depression by just addressing the problems that come with ACEs. It's quite a huge percentage. One of the strongest relationships seen in the ACE study is between ACEs and the risk of suicide attempts. So people with an ACE score of 4 have almost 20 times the risk of suicide attempts as people with an ACE score of 0. Suicide rates are 52% higher with kids who have 4 or more ACEs, and the Alaska data shows a higher rate of suicide attempts, indicated by the star here. There's a huge statistical significance associated with ACEs and suicide attempts. And then the same pattern can be seen with ACEs and cancer risk, even after adjusting for factors such as smoking. Adults with a history of multiple adverse childhood experiences nearly had twice the rate of cancer as those without childhood trauma. And this is just a risk. You might know someone who smoked and who never got cancer, but you might also know someone who had lung cancer but who didn't smoke. And so we'll talk about maybe why that might be. In all of this, Dr. Villetti was concerned about how people would receive the results of the study, and he didn't want there to be any shame, guilt, or judgment, but he wanted to remind us that people, don't grow up wanting to be alcoholics, or often the types of behaviors that are coping for adversities when a child is younger are still maybe present as adults. So really learning about the effects of ACEs is the first steps towards healing, and we'll kind of talk about how that cycle can be broken, and how there is hope and healing through resilience. So how do we put this all together to make sense of understanding ACEs as a powerful pathway to health and well-being? We understand that ACEs are pretty common and have a strong cumulative impact on the risk of common health and social problems. And preventing ACEs is a great opportunity for improving the well-being of the human population. And in fact, the ACE study team and ACE interference believes that this is the greatest opportunity of our time. So this slide shows the percentage of various social and health problems that epidemiologists estimated are caused by ACEs. And the black cloud in the middle is basically the percentage of that health problem that can be attributed to an ACE score. So an example here, 22% of people with asthma have it due to ACEs, whereas the rest of the people with asthma have it due to genetics, allergies, and other factors. So you can notice in some of them, the percentages are quite large, and the high percentages on this chart are rarely seen in public health studies. Here's a slide showing the cost of ACEs using the population of attributable risk. Sorry, I cannot speak today. For the state of Alaska in 1 year. So you can kind of see the health behavior and the costs associated with addressing that health behavior outcome and how it might be linked to annual costs associated with ACEs. So these 3 boxes just kind of represent some of the things that might arise across like the lifespan. So looking at young adulthood, midlife, and then later in life. And of course, any of these outcomes can turn up in anywhere in the life spectrum, but they're more likely seen within that period of life. This pyramid shows the progression from ACEs to early death, and it's missing the bottom level. So the pyramid was from the original ACE study, but it is missing intergenerational trauma. And that trauma from a previous generation could be passed down epigenetically, and we'll discuss what epigenetics is. But this is, I think, an important component to when we're talking about ACEs. An example of intergenerational trauma is, for us being in Alaska, the Alaska Native population being, forced into boarding schools or losing their culture. And, within that separation, they also experienced abuse within those boarding schools. So that toxic stress caused by those events are passed down to each generation. And this can also be seen in events like the Holocaust and Japanese internment camps, and kind of how it affected generations to come. So ACEs really disrupts neurodevelopment, or can disrupt neurodevelopment when experienced, and it can impair a person's social, emotional, and cognitive abilities. And these impairments lead to the adoption of coping in ways that are not healthy, that could lead to disease and disability, as we saw in previous slides. So throughout this, up to this point, you might be asking or reflecting on your own upbringing and might ask, well, what counts as an ACE score? So there's 3 types of stress. There's positive stress, there's tolerable stress, and there's toxic stress. Can you all provide an example of what positive stressors might be? You can put it in the chat box. Exercise, okay. A test, yeah. Being anxious before a test. Maybe before a big game, when a cute guy you like notices and talks to you. Yes. yeah, those are all great examples of what might be positive stressors. It really is like maybe a motivator. And what about tolerable stress? What are examples of tolerable stress? COVID-19, yes, that is very relatable to today's time. Dealing with a diagnosis, yeah. Not being able to go out, yes. Maybe a big project is coming up, or maybe you're planning for a big event. Um, those are all good examples of tolerable stress. What about toxic stress? What are examples of toxic stress? Death of a family member and friends. A hostile workplace, yeah. So it's those events that you can't really avoid and that you're always constantly, um, like your stress response system is always on. So an ACE, and this is what happens with ACEs, is um, that stress response system is prolonged, and it doesn't turn off. And it's usually as a result of not having protective relationships around, um, or there isn't hope seen in the situation that a person might be in. So for ACEs, we know that childhood is a time of development that requires good nourishment and to allow for growth rather than toxic chemicals or hormones that are released from toxic stress. And we know life is full of stress. It's unavoidable, and we're really designed to handle stress to a certain point. And our bodies usually heal themselves, right? You know, if we're talking about tolerable stress, you might be planning for a big event. And in those moments of planning, you might be very stressed out, and you might even get sick because your immune system is made weak. But once that event is over, you recover from that. But with toxic stress, when that constant activation of stress response is always on, it over time can lead to changes in the body's response to the stimulus or long-term effects such as changes to brain development for children. So sources of toxic stress, for example, come from the 10 ACE categories that were mentioned, and then from experiencing poor social determinants of health as well. So these are factors that contribute to an individual's health. This could be economic, such as income levels. So maybe someone's living in poverty, maybe social and physical environment, maybe not living in a safe neighborhood or experiencing racism and discrimination. Or it could be a child who may be bullied. So really lots of things can lead to toxic stress, and people have different tolerances to stress. What might be traumatic to one person might not be the same for another person. So now we'll look at toxic stress and brain development. So this term synaptic density is basically how neurons within our brain are connected to make neural pathways. And synaptic density is greatest in younger years, and as a child grows, synaptic pruning happens. And this is where any neurons that are not being used are pruned away, and other neural pathways that are frequently being used are strengthened. So that leads to neural efficiency. On the left, you can see a set of brain cells or neurons and what they might look like at the time of birth. And you can see that there's not many connections between these cells at birth. There are not many connections between them, so babies are born with only the connections and brain functions that they need at that point in life. Now, if you look at the 14-year-old, about the same time of puberty, you notice that there are now fewer connections between the brain cells than there were at the age of 6. This is because the least experienced connections tend to withdraw at about the time of puberty, and this process is called pruning. And this phenomenon helps to explain why neglect or not getting the experiences we need can have such powerful negative impacts on health and social functioning. So I'll play this quick video on the brain.
A child's experiences during the earliest years of life have a lasting impact on the architecture of the developing brain. Genes provide the basic blueprint, but experiences shape the process that determines whether a child's brain will provide a strong or weak foundation for all future learning, behavior, and health. During this important period of brain development, billions of brain cells called neurons send electrical signals to communicate with each other. These connections form circuits that become the basic foundation of brain architecture. Circuits and connections proliferate at a rapid pace and are reinforced through repeated use. Our experiences and environment dictate which circuits and connections get more use. Connections that are used more grow stronger and more permanent. Meanwhile, connections that are used less fade away through a normal process called pruning. Well-used circuits create lightning-fast pathways for neural signals to travel across regions of the brain. Simple circuits form first, providing a foundation for more complex circuits to build on later. Through this process, neurons form strong circuits and connections for emotions, motor skills, behavioral control, logic, language, and memory during the early critical period of development. With repeated use, these circuits become more efficient and connect to other areas of the brain more rapidly. While they originate in specific areas of the brain, the circuits are interconnected. You can't have one type of skill without the others to support it. Like building a house, everything is connected, and what comes first forms a foundation for all that comes later.
So that just provides how the brain is interconnected and really like the pathways information flows within it. In the parts of the brain that are responsible for learning and regulating emotions are your amygdala, which is the emotional center that filters the information or protects us from threats, whether they're real or perceived. And usually if there's no threat, the information that flows then, or I guess the information then flows to the prefrontal cortex, which is where our learning, reasoning, and thinking takes place and the information is processed. And usually that's called our executive functioning. Then you have the hippocampus that stores what has been processed, acting as a memory system. If the emotional center or the amygdala is blocked in some way, the information can no longer go through because of maybe there's a threat of some kind, whether it's a real threat or a perceived threat. And in that case, where it doesn't make it to the prefrontal cortex or maybe your hippocampus, we respond with emotion. So this is where our fight, flight, or freeze comes into play. And it basically shuts down our ability to think, and we basically react without thinking about what to do. So here is an example of how ACEs affects early development of the brain. This slide shows a brain scan taking place in real time, and it's basically comparing a brain of a healthy child versus the brain of one who's severely emotionally neglected. And if you recall from the previous video, it showed the importance of interconnections for the brain for learning, socializing, and emotions to take place. And you can see that in the severely emotionally neglected brain scan on the right, it shows a loss of connectivity to the frontal lobe where learning is supposed to take place. But if you look at the back of the brain where visioning is being processed through your occipital lobe, you can see that there's some form of activity. And that means that the child is alert and visually aware of their surroundings. So a child with ACEs can have a difficult time learning or remembering because those neural connections that allow them to think, to learn, to reason are cognitively inhibited. Another way ACEs harms is, with toxic stress. Is kind of just always releasing these hormones. So I will use an example of being chased by a dog. Everyone who knows me knows that I am not a fan of animals. And it's because I've had one too many experiences with them growing up, not good ones. And I think of like dog chasing, or I've been chased by a lot of dogs. And, like in those moments, I always wonder why I ran so fast, like all of a sudden. But it was because I was, my stress response system was turned on, and I now was flooded with a bunch of adrenaline and cortisol, which provided the speed and energy that I needed to get away from that threat. Now, that is a good response to have when you're in danger. But if this response it's usually only supposed to be activated for 20 minutes. And if that response is always on, it's gonna take a toll on your body from these chemicals being released. And it's really not a great feeling to always be hypervigilant and to always be just on alert. Here are some other examples of how stress affects the body when it's activated for extended periods of time. With your brain, maybe it's having a hard time concentrating. Maybe there is a knot in your stomach all the time. Your joints hurt, things like that. And, for children, stomach aches are pretty common and they're pretty real. And sometimes that could be caused by stress. So we can think of our executive functioning as a road like this on this slide. And sometimes you go through these processes pretty quickly, like when we're driving and we see a ball rolling in the middle of the street. You usually make an observation, you interpret it, you process what you're going to do, and then you make a plan. Other times, this process is pretty slow, like if you're problem solving, you're wanting to make a decision of some sort, you might go through this road a little slower. When we're under stress or extreme stress or feel threatened, we skip the process processing and evaluating and weighing our options that happen in that prefrontal cortex, which helps. And instead, we react immediately, with the fight, flight, or freeze. So now we have a freeway path or express route. When a person is continually exposed to stress or threats, the path of going straight and on this logical path basically is non-existent, and you now are just using the freeway system, and the path is going straight into action without thinking about the behavior that might come about or that's being used. So you can kind of think of it as a car accident. Maybe some of you have experienced a car accident. You can kind of recall maybe how you felt the next time you got into a car. Maybe you became tense. Maybe your heart started pumping really fast. And really, in those moments, the stress response is reactivated because your body remembers. The event might have passed and you might not be in that environment, but your body remembers that experience. And it does take some time to get over it. So now imagine a child who lives in a household where parents are always arguing, or dealing with a parent who gets drunk often. And in these instances, they usually hide maybe in the closet or somewhere to get as far away from the situation as possible. That toxic stress that the child feels in those moments may continue into the next day in the form of maybe hearing raised voices, or maybe a door slamming, or maybe they're just constantly thinking about the abuse or the neglect or the domestic violence that they may go into or may experience again. So now that we can understand how toxic stress affects the brain long term, this form of stress impacts the development of neural pathways. And we mentioned earlier epigenetics, and we'll watch a quick video on what that is and why it's related to ACEs. If I can play the video, let's see. Oh.
Hi, this is Jack Mack, and I want to talk to you about the fascinating science of genetics. Well, in actual fact, I want to talk to you about the new exciting field of genetic science called epigenetics. Now, epi literally means above. So when I say epigenetics, I mean above genetics. Our bodies are made up of cells, and inside our cells, there's a nucleus. Inside the nucleus are things called chromosomes, and our chromosomes are made up out of DNA, which is our genetic blueprint for life. Our DNA blueprints are completely finalized at the moment of conception, and they never change throughout our entire lifetime. These blueprints determine our default future physical characteristics. Things like whether we'll be male or female, how tall we might grow, what our hair or eye color might be, etc. However, the genes don't always do what they're supposed to do. Although the DNA blueprint never changes, the packaging around the DNA, things called methyl groups and histones, sometimes switch off the gene and therefore stop it from acting according to plan. Epigenetics studies these potential changes and how these changes can be passed along to our children along with the DNA itself. It's like sticking post-it notes to a blueprint and saying, that's the plan, but don't do that part of the plan. To understand this best, it helps to think about twins. What's up? Identical twins have the exact same genetic DNA blueprint in every single way. And if we separate two exact identical twins for 3 decades, the first experiences a peaceful, happy life with access to a healthy diet and no major emotional trauma or stress in his work. The other is malnourished as a child, addicted to drugs as a teen, and grows overweight in his 20s. He loses his wife to a car accident and has a very high stress job. Standing them side by side after 30 years, we would likely see some very visible external differences. But more than that, there would be lasting changes at an epigenetic level. The blueprint would remain unchanged and identical, but the overriding cellular activity would have changed the way some of those genes had expressed themselves permanently. This science is very new, but early indications suggest that these epigenetic changes not only impact the individual, but can potentially be passed on to children, grandchildren, and beyond. Things like stress and diet seem to have a profound lasting effect over how our genetic blueprint operates. And so a stressed pregnant mother with a bad diet could potentially be impacting the epigenetics of her grandchildren. This is a fascinating new field of science and one we're certain to hear more about. But for now, I'll just be trying to manage my own diet and stress, not just for my sake, but for the sake of my grandchildren. Jack Mack, over and out.
That was just a brief example of, how our genes and what we might be at risk for, why they might or might not be expressed, and of course we have resiliency to play into why they might not be expressed. So, in all of this, the effects of toxic stress, they're not permanent, and it's not the end if someone is experiencing prolonged periods of stress throughout their life. And people who have many ACEs can still live pretty healthy and productive lives. And this is really due to the protective factors or maybe systems that are in their lives that help them to heal or to make sense of their experiences. And there, are things that we can do as individuals. There's things that we can do as a community. And there's things that we can do on a policy level that could reduce the effects of toxic stress and increase the resiliency to these life events and adversities. So to end this presentation today, or part one at least, I'm going to show you a quick video. Let's see.
Hi, this is my neighborhood. I grew up in this building. This is a great community now, but it's had its share of problems. When I was a kid, our community had high unemployment, a lack of resources for families, and lots of kids hanging out with no adult supervision. You might have heard about adverse childhood experiences, or ACEs. ACEs are traumatic events in childhood, like abuse and neglect, that can increase risk for future problems. But they don't have to. The good news is that ACEs and their consequences can be prevented. Take me, for example. I was at risk for ACEs, and despite all the things that put me at risk, some pretty incredible people helped make sure that I wouldn't become another statistic. Come on, I'll show you around. That's Jackson. He's a cool kid. His dad left when he was 2, and his mom works 2 jobs. I hang out with him every Thursday night and help him with his homework. Sometimes we grab ice cream. It's fun. Plus, he has another adult role model to learn from and trust. That's Mr. Martino. When I was a kid, he let me help him at the store sometimes after school when my parents were working late. He did that for a bunch of us. My dad actually found his job as a mechanic because of Mr. Martino. This helped our family in so many ways. Not only did my dad have a steady paycheck, which eased his stress about paying rent and buying necessities like food and clothes, but he was also a lot nicer to me, my brother, and my mom once he started working a job that made him feel good about himself. When communities come together, they can do so much to prevent ACEs. Mr. Martino and other local business owners put together a series of career workshops to help people like my dad find work. My mom also got a job with a company that allowed her to work from home and spend more time with me and my brother. Mariana has just gotten out of a class about handling challenges of single parenting. The clinic offers free childcare so Mariana's daughter, Ella, can play while Mariana's in class. The class helps parents like Mariana develop positive parenting skills, not just for babies and toddlers, but for teenagers too. This is another way our community has come together to give families the resources they need. And just one more way to prevent ACEs. This was my school, Riverside Middle, right in the heart of town. These kids are here for a sponsored summer camp. This community-supported program helps families with affordable, quality childcare and helps kids get tutoring and learn life skills. When I was a kid, I spent a lot of time at this school all year long. There was one counselor, Miss Greer, who I remember more than anyone. She was a really good listener. Miss Greer helped me and my brother get involved in after-school activities like baseball and soccer. Our coaches were super nice and were mentors to us. Staying after school for practice kept us and a lot of other kids out of trouble. When schools help take responsibility for preventing ACEs, everybody wins. My life could have gone in a completely different direction. Studies show that ACEs can have long-term negative effects on kids' health and well-being that may last into adulthood and even continue in future generations. But by people and groups taking action, ACEs can be prevented. In fact, there are 5 known strategies that help stop ACEs before they even start. You can implement them in your own community, just like we did. How? By strengthening economic support for families, by changing social norms to support parents in positive parenting, by providing quality care and education early in life, by enhancing parenting skills to promote healthy child development, and by intervening to lessen harms and prevent future risk. So, now you know my story, and you've seen the prevention strategies in my community that helped me beat the odds. I had healthy relationships with my family and friends. I learned how to take care of myself and make good choices. And today, I'm a mentor to other kids who need some extra help so they don't become an ACEs statistic. Stable and nurturing relationships and environments are essential to prevent child abuse and neglect and to assure that all kids reach their full potential. Are you thinking what I'm thinking? Banana split? You got it.
Yeah, so there's many things that we can do, and I think it starts with awareness and acknowledgement of ACEs and the importance for it to change perceptions. And we need to also recognize that the roots of ACEs may stem from individual circumstances, but as a community and collectively, we can make greater change. And maybe this is reducing stigma around these challenges and issues, promoting safe environments that foster healthy relationships, or that foster positive youth development. So that was a lot of information thrown at you. I hope I didn't go too fast. But thank you for joining us for part 1 of ACEs. And I hope you can join us again on Wednesday to dive into the core protective factors, talk more about resiliency and what it is, and to learn about trauma-informed practices that we can adopt. So if you have any questions or comments, feel free to stay. I'll be around for a few more minutes. But hope you all have a great afternoon. Yes, there are links for previous slides, and we can get those out to you.